It's good to be back, particularly good to be back in the aftermath of the successful campaign of Catherine Connolly, and can I congratulate her in her position as our new president. It's also good to be back on the day that a socialist gets elected in New York. Signs of hope and portents of the future. My biggest debt of gratitude is to the fantastic people who work in our health services, particularly in the cancer services. In my case, St. Luke's and the Eye and Ear Hospital. 50% of people will have an encounter with cancer during their lives. 44,000 people this year will get a cancer diagnosis. But there's a very particular issue for me and for the people who provided me with the care in St. Luke's in the area of radiation oncology machines. They're called linear accelerators. They basically have given me my life back and the staff, the infrastructure and so on. And 50% of those very high figures who get a cancer diagnosis each year will need these machines. But fairly incredibly, 35% of those machines, which are supposed to be replaced every 10 years, are now 15 to 17 years old. 40% will need to be replaced in the next 5 years. And this means there's a lot of discomfort, stress for patients, for staff who need this life-saving treatment. And what the people who work in radiation oncology are asking for, and they've asked repeatedly for this, is for a national radiotherapy replacement programme that is where there's centralised oversight and procurement and where there's ring-fenced funding going forward, multi-annual funding, so they don't have to come each year with a begging bowl for money to provide this absolutely vital machinery to save lives. Professionals in this area say the following: radiotherapy services are operating significantly below capacity due to under-resourcing. Our healthcare staff do everything they can to minimise the impacts and care for patients. However, it is simply not possible to provide optimal care in these conditions. 16 of 24 working days last month were affected by unscheduled downtime because machines are breaking down because they are too old, putting stress on patients and staff. 23 million a year is been spent on outsourcing to the private sector because of machines breaking down, not being replaced, and the lack of a national replacement programme where, as I said, doctors who should be providing from the services and the care to patients are instead, in their own words, coming looking to the minister, governments, departments, begging for the money, the resources and so on to replace the machines they need to provide the care to save lives. So you need to respond to the specific request to have a national programme for the replacement of these machines and the staff and the infrastructure necessary to deliver it.